Can I have everyone to please make their way to their seats? Our next panel is about to begin. We are going to be focusing on challenges in humanitarian work, moderated by the lovely Juliet Foster. Thank you.
Okay, I believe that we have the queue to go. So please, everybody come in, take your seats, and we are about to begin our panel. So first up, I'd like to say good afternoon and thank you for joining me on the final day of the 2023 Global Humanitarian Overview. I'm sure I met most of you yesterday at the opening session, but for those I didn't meet, my name is Juliet Foster, and in a few moments I'm going to be moderating the panel, Challenges in Humanitarian Work. Now, it is an appropriate subject given everything that is currently happening in the world today. I'm sure that most of you heard about the further earthquakes in Turkey, on top of the tragedies which have happened already in the last few weeks. So again, more pressures there for those involved in finding survivors and also dealing with those who've been left behind. But also as well, Russia's invasion of Ukraine has internally displaced 5.9 million people, while almost 8 million Ukrainians have crossed into neighboring countries in the region, including Moldova, Poland, and Hungary. Now, Ukraine's misery does have far-reaching consequences that are already being felt. It is impacting food security and systems in Africa, from the inability to import staple crops to the long-term implications of fertilizer restrictions. Over a third of African countries rely on Russian and Ukrainian wheat imports, with 20 African states buying in around 90% of their wheat from the two warring countries. Since Moscow's tanks crossed into Ukraine a year ago this week, global food prices have skyrocketed, and for low to middle income countries struggling against the backlash of weather extremes and limited resources, that spelt disaster. 50 million people across East Africa are being pushed towards starvation, where even the most basic nutritious foods are at risk of falling out of reach. What the Ukrainian experience tells us is that a humanitarian catastrophe in one part of the world can compound another elsewhere, such is the nature of global interconnectedness. Climate change, drought, war, population displacements, and the breakdown of health or social infrastructures are a dangerous, toxic mess that somebody has to make sense of in order to navigate. To which I say, welcome to the world of the 21st century humanitarian. So much for the operational landscape. How can help be administered to traumatized communities on the verge of falling apart, assuming they haven't done so already, when the funds that could make a difference might be in short supply? How can humanitarians maintain their neutrality in a diverse and crowded field of actors where offers of unconditional assistance might not always be welcome? Who should be trusted or indeed avoided at all costs? The bottom line is that humanitarians are doing a difficult job in a constantly shifting landscape. They have become an easy target for attack, either verbally from critics at home or physically from those in the field. In the words of Gareth Price-Jones of the Steering Committee for Humanitarian Response, the incentives to attack humanitarians remain much the same. Denying assistance to populations that may support opposition groups, removing witnesses to atrocity, allowing greater military freedom of movement and blocking or discrediting independent narratives around levels of humanitarian suffering. Hold those thoughts and let's meet our panelists. First up, Lisa Dalton. Lisa is Director of Humanitarian Financing and Resource Mobilization at the UN Office for the Coordination of Humanitarian Affairs. It's good to see you. She also oversees the daily operations of the CERF, that is the Central Emergency Response Fund. Lisa, thank you for joining us. Jessie Mason is Global Coordinator for Anticipatory Action at the World Food Programme. Jessie, it's very good to see you too. Please also welcome Benjamin Davis. Ben is Director, Inclusive Rural Transformation and Gender Equality Division at the Food and Agricultural Organization. Dr. Maria Nera is Director, Public Health and the Environment Department at the World Health Organization. She's been with the WHO since 1993. It's good to see you. Let me also introduce you to Elke Meyerhofer. She is the UNFPA Regional Humanitarian Advisor for the Arab States region with more than 20 years of experience in the arena of international cooperation. She's also worked in the Arab region since 2009. We also have with us Kit Dyer. Kit is Humanitarian Specialist for WASH, that is the Water, Sanitation and Hygiene Group for UNICEF in the Middle East and North Africa region. And also, can I introduce you to, on my list, Manuel Pereira. Now, Manuel is Head of Division for Migration, Environment and Climate Change at the International Organization for Migration, or IOM. And finally, I'd like to introduce you to Sheikha Hissa Al-Thani. Now, she's the envoy of the Secretary General of the League of Arab States for Humanitarian Affairs. And I'm asking you, our audience, to welcome our panel. Please show your appreciation for their presence. Okay, so just to give you an idea of what's going to happen, I'm going to put some questions, 2 questions each, to some of our panelists. For some of them, it's just 1 question. They will have 7 minutes to complete their answers. And then at the end of this particular segment of this discussion, we will then go on into a much wider question and answer session. So I'm going to start by putting the first question to you, Lisa Doughton. But before I do, if anybody wants to address the audience from here, please do feel free to do so. You'll also be doing my feet a favor because they'll be having a rest. High heels are not a good idea for these things. But look, Lisa, you've got 4 minutes, and my question to you, the first one is, from your perspective, what are the key challenges facing humanitarians? Not to put too fine a point on it, they're huge. Yeah, can we have her microphone on, please?
Hello?
Yep,
Yes,
that's
okay.
fine. We can hear you.
Key challenge number 1, to be heard.
I think somebody else is.
Yeah, Kit was talking, but your microphone is live.
Okay, very good. Okay, thank you so much, and also thanks again to the Kingdom of Saudi Arabia for hosting this forum. So in terms of the challenges, you're right. There's so many, but I'm going to talk about 4 specifically. First, crises are growing in magnitude, frequency, and severity. So this year, 339 million people need humanitarian assistance. That's 1 in 23 people on this earth. So it's quite amazing if you look around here, how many people, how many of those would actually be proportionally needing assistance. So what's behind these things? These numbers, there are 4 things. 1, there's hunger. 222 million people will not know when they'll have another meal. Nearly 1 million people are at risk of starvation in Afghanistan, Ethiopia, Haiti, Somalia, South Sudan, and Yemen. Displacement is another thing. The number of people displaced globally continues to grow, reaching a record 103 million people. Also epidemics. So there's a rise in mortality from epidemics like cholera and COVID-19. Infant vaccine coverage has reached its biggest drop in 30 years, which is a disastrous thing for the future generations. The pandemic, of course, set back the whole development clock, and we're off track to end poverty by 2030. And women and girls are the hardest hit, as we know. It'll now take 4 generations in order to reach global gender parity. Conflict is the last thing I want to mention in terms of one of the behind the numbers, which is prolonged conflicts, such as in Syria and Yemen, new conflicts which plunge millions into dependency. The war in Ukraine has caused so much devastation, as we see on the news every day. In terms of the challenges, I see the second one is the price tag for the assistance. It continues to grow and is moving much faster than the funding that's available. So the humanitarian response system is being tested really to its limits. This year, in December of last year, we launched the Global Humanitarian Overview, also including here in Riyadh. And we appealed for $51.5 billion to assist 230 million people in 69 countries. Those are the most vulnerable of the 339 million I mentioned that are in need. Last year, we received $24 billion in funding, which is less than half of our goal. So although it fell far short of what we actually need, humanitarians used the funding to reach 145 million people, or close to 80% of our target. Now that actually means that the system is increasingly delivering more value for money. So for example, while the number of people in need has more than doubled in 5 years, the funding requirements have only gone up 1.5 times. The pooled funds that OCHA manages on behalf of the humanitarian system play an important role in all of these efforts because they're not only financing instruments, but they also support coordination. The Central Emergency Response Fund, or what we call the CERF, and the country-based pooled funds that we manage enable partners to respond very quickly and at scale, providing $1.7 billion in principled needs last year. So another one of the challenges I mentioned is the operational environment is getting so much more complex every day. Humanitarian need is concentrated in the most fragile countries where economic decline, violence, extreme poverty, lack of basic services collide, making humanitarian work even more challenging. Likewise, what is a huge challenge for humanitarian workers is that they are targets. They're often caught in the line of fighting in many of these very fragile and conflict settings. If funding requirements are or one of the pieces of the measure of complexity, I should note that 10 country programs this year have needs over $1 billion. So they include Afghanistan, the Democratic Republic of Congo, Ethiopia, Nigeria, Somalia, South Sudan, Syria, Ukraine, and Yemen. So the requirements have also grown in many other countries of crises that are not on the front lines, on the headlines all the time. So for instance, in Haiti, where mounting violence, staggering inflation, and outbreak of cholera has almost doubled the needs in that country. Also in Afghanistan, drought and a crackdown on women's rights has further exacerbated the needs of 28 million people. The last challenge I wanted to mention here is climate change is picking up speed and winning the race in many places. We've heard that many times during this forum. It's claiming the lives of the most vulnerable and fast outpacing the world's attempts to stem that. So COP27 is really, I would call it an aha moment for also humanitarians, but for many, a global recognition of the really difficult injustice that those who are suffering the most are those that are not causing it, are at the central cause. They're the most at risk, however. The Horn of Africa is enduring a 5th consecutive failed rainy season. And last year we saw how record flooding submerged the entire villages and harvests in Nigeria and in Pakistan. So a lot of this humanitarian work focuses on responding to the consequences of climate-related disasters. For instance, this year's extreme heat events, or last year's extreme heat events, where they were more dangerous and made life very less livable. 2022 saw communities across the globe sort of melting under the very high temperatures. China, for example, recorded the most severe heat wave ever anywhere. And Pakistan's ongoing flood emergency was preceded by a series of extreme heat which hardened the ground, which made it less able to absorb the enormous rainfall and flooding that came thereafter. There's a report called Extreme Heat, which was issued by the International Federation of the Red Cross and Red Crescent Society and OCHA, which I invite you to read to hear more about how heat is increasing vulnerability. So in short, these challenges make us look at more humanitarian work moving forward, which also means we need to proactively create and seize more opportunities to make it a better and stronger system to do that.
Okay, thank you so much for that. Can you now tell me what are the opportunities? You have 3 minutes, so again, if we could be brief in our answers, because we have a lot of ground to cover.
Yes. Okay, so in terms of the opportunities, I will try to be very quick. First, humanitarian work can and should be more local. We need to involve the local responders. They're the ones that are there when disasters happen. They'll be there after. We're taking important steps to empower local response and working with them, listening to them, giving them voice and agency, which is the next part as well. We have to make sure that humanitarian assistance is more accountable to the people we serve. So again, listening to them, providing them that opportunity. Thirdly, humanitarian work can and should be more nimble. So one way of doing that is providing cash assistance, which also addresses the needs, the needs that people have. Rather than providing them with basic supplies, they then can decide what is most important for themselves. So that way, the cash transfers enable people to it's also more accountable. They're able to address those needs. And just as an example, last year in Ukraine, the humanitarian community implemented the largest humanitarian cash transfer program in history, which transferred $1.7 billion more through the system to 6 million people, which was an enormous effort, an enormous leap in how we can assist people. Fourth, humanitarian work can and should be smarter and more collaborative. We need to use increased technology and innovation to ensure that it's delivered more quickly and more effectively. A couple of examples of that are using AI to estimate population densities in crisis areas, social media to fight disinformation and hateful rhetoric against humanitarian organizations. Fifth opportunity is that it can and should promote more sustainability and long-lasting solutions. This is where we can work better and smarter, and we can also link to development organizations to ensure that those that move out of humanitarian don't slide back into humanitarian situations and protect those gains. And then the last thing I would mention is that humanitarian work can and should be more anticipatory. We need to act before the disaster actually hits. And we see data that shows that 30% of crises and the needs can actually be predicted. And so we can address those before they occur by providing early action and anticipatory action. So I think just to conclude, a couple weeks ago, the Secretary General did a walkthrough in OCHA, and he was talking about the enormity of the challenges that the world is facing. And he said that there's one thing that really saves us, and it ensures that we all work together as a humanitarian system, coordinate, and make sure that we seize these opportunities and address the challenges.
Thank you so much for that, Lisa. A very comprehensive response to those two questions. Let me now go to Jessie Mason. You have two questions as well. I'd like you to respond to this one in 4 minutes. Again, if you wish to come here, do feel free. But my question to you is that a few moments ago, you heard Lisa reference the need for collaboration, also partnerships. But how can agencies do this in a way that is meaningful? 4 minutes.
Thanks so much. I really appreciate it. And I really appreciate the colleagues who've made it here after lunch and joining us in this important discussion, and KSA for hosting us. And I think that's key to our issue here, which is making sure that we have time to discuss, making sure that we have time to work together long before the impacts of climate hazards or other on people are visible. And so yesterday there was a discussion during the Humanitarian Development Peace Nexus, and I think there was a point there that was really important for us to capture here, and that's our actions are not the sum of our collective inputs. They're pieces that we need to start to plan together long before the needs are visible and long before people are suffering. And I think that's key to us being able to practice this, being more nimble, being able to move quicker, and being able to work together. And so as we have this discussion under this changing climate and the losses and damages of the consequence of failed collective efforts in reducing levels of global warming and substantive underinvestments in systems to predict and protect, this is a point in time that we need to come together. So I wanted to focus on the part about where we can put this into practice. How does this actually become more meaningful? And to support this shift in the humanitarian system from increasingly expensive crisis response to a more forward-looking management of climate risk, organizations such as WFP, FAO, OCHA, IFRC, and the START network of NGOs have piloted anticipatory actions ahead of different types of climate hazards and across diverse country contexts. This collaboration has led to the development of operational frameworks that Lisa had just mentioned, for anticipatory action that define the roles of different partners, the early warnings to be used, the co-targeting of at-risk people, as well as priorities for evaluation and learning. This learning part is the part where we get to be able to learn from these issues and start to improve the way we collectively work together. As we have just heard from Lisa, and yesterday from Germany, we've also developed protocols to release flexible financing predictably and rapidly when a pre-agreed trigger point has been reached. This collaboration has evolved into the development of interagency anticipatory action frameworks led by global and country teams and NGO partners, as well as joint targeting and evidence protocols. As a result, when we've seen devastating floods in Nepal this year, in Bangladesh in 2019, financing reached local agencies and communities days before the floods arise, allowing families more time to prepare, save lives, and protect assets. And these similar processes are happening across countries in the places where we work together. And this is where I think we start to put this into practice on how we become more nimble and how we start to plan long before the suffering is visible on people.
Okay, my second question then, if humanitarians are guilty of silo working and thinking, doesn't it follow that they're making things worse for themselves by not acting collectively? 3 minutes.
Thanks so much. Well, it's certainly making it less efficient and more challenging to collectively get ahead of the curve, right? If we're not sitting down and having these conversations long before we're under the cloud of emergency, long before we're trying to move forward ahead and save lives, it's going to make it very challenging for us to get ahead of a changing climate. And one challenge we observe at country level is that the tools, resources, and protocols that are already available within our individual partners and our individual agencies are not systematically applied across partners and country teams. And that good practices are not integrated into the humanitarian program cycle. These learnings, these opportunities that we've been able to collectively generate together need to start to inform the way we look towards the future. We also see a need to become more systematic in sequencing and combining different sources of financing. We heard that today from the minister around how we start to leverage insurance and anticipatory action finance, development finance, and climate finance, so that early warning and anticipatory action systems can be meaningful, coupled, and prioritized in national climate adaptation plans and augment rapid response needs. We need to be able to see this as part of a collective picture that we're all contributing to, and ensuring that we're not looking at just the short-term needs, but how this pushes us forward into the future. And we have an opportunity to discuss how we can collectively support this change, to leverage the learnings, tools, and resources that our respective agencies are developed to strengthen a more effective use of early warning systems and anticipatory action frameworks at country levels. Governments and their humanitarian and development partners require forward-looking risk management systems to avoid predictable climate hazards from turning into humanitarian emergencies. And thanks to progress in climate modeling and impact-based forecasting, this is now possible. Robust early warning systems, as we heard today, around the Early Warning for All initiative can facilitate decisions to release prearranged financing and pre-agreed activities, which can protect lives and livelihoods long before new climate shocks occur. Such anticipatory actions save lives, time, and money, which WFP and our partners have been able to demonstrate through expanding anticipatory action programs.
Okay, Jessie, thank you so much for that. I'd like to move on now to Ben, who's sitting next to you. Now, I'm going to give you 7 minutes, so you're having one question. 7 minutes, please, don't overrun. But look, there was a session yesterday on the Humanitarian Development Peace Nexus, and during that session we heard how one of the solutions to some of the many challenges that you guys face can be addressed by better aligning humanitarian development and peace investments and objectives. My question to you is, how can you do this in practical terms, given the reality of what's out there? 7 minutes.
Great. Thank you very much, Juliet, and good afternoon, everyone. It's a pleasure to be here today. I think we really have some challenges, which I'm interpreting as someone who comes from the development world, let's say, looking at the humanitarian world. One is some of the challenges in humanitarian work need to be addressed through the humanitarian development peace nexus. We need to specifically to better leverage existing government spending, development partners' investments on development, that's systems, policies, infrastructure, program, institutions, for humanitarian response. And this sets the foundation for a more effective humanitarian response. Now, saying it is much easier than actually doing it, and the big challenge is how do you do it in practice, right? Now, part of the challenge is that these are different worlds, the humanitarian action and development action. There's different speeds, immediate response versus long-term planning. There's different incentives. There's a different imperative to action. There's different training and skill set among the actors themselves, different sources of funding, different priorities of donors, and there's a different language. We speak different languages. We often don't understand each other. Now at FAO, we have a fair amount of experience in facing this challenge since we're primarily a development organization, normative focused, with technical expertise in a broad array of areas around agriculture. That's crop, livestock, fisheries, forestry, etc. And in our humanitarian work, really our value added derives from this technical expertise. So for example, social protection, which is a technical area under my supervision, and one which we work closely with our Office of Emergencies and Resilience. It's an important tool for operationalizing the HDP nexus, whether we're talking about slow or rapid onset of climate-related disasters, COVID-19, conflict, or other crises. Now, social protection, and here I'm talking about policies and programs that address social and economic vulnerabilities, cash transfers, school feeding, labor market interventions, etc. It's long been used as a development tool, and it's long been used as a humanitarian response. But really only recently has there been a fundamental shift towards trying to bring these worlds together. Now, it's really a two-way street. One is how can functioning social protection systems facilitate the flow of humanitarian aid? And how can this aid be better aligned with government systems, with national objectives and priorities? It's both about strengthening government systems as well as improving and institutionalizing the delivery of aid. Now, what have social protection systems, programs, and tools, how have they been leveraged by humanitarian actors? So you can use or build off existing social registries and program registries for targeting, management information systems to manage caseload. You can use or expand existing social protections programs to implement humanitarian aid. You can use the experience and data from existing programs to design humanitarian interventions. You can take advantage of national staff for outreach. And you can leverage existing disbursement modalities as well as grievance mechanisms. But I think more fundamentally, it's the existence and the expansion of social protection systems and programs prior to emergencies which can help, let's say, reduce the need for the massive humanitarian response. Because social protection plays this preventive, protective, promotive, and transformative functions, right? So it strengthens resilience of households against shocks, averts losses of income, assets and livelihood, and it contributes directly to risk mitigation and disaster preparedness. It also protects people in the case of shocks by providing basic subsistence and providing relief. But it's also promotive in that it promotes livelihoods and it builds resistance within livelihoods. But it also can be transformative in the sense that it can address structural inequality as well as promote inclusive economic processes in the long term, which can reduce and avoid a lot of the sources that lead to humanitarian crises. Now, of course, the problem is that countries that are most at risk are those with the least effective coverage of social protection systems, right? So I think the point here is that if we want to use social protection systems in order to address these covariate risks, we really need to invest in government systems where they're needed most, okay? Now, I just want to give one example, really, of how this has played out in practice, and that's the global response to COVID-19. Okay, and so social protection was the #1 global response to COVID-19, to the negative impact of the pandemic and the ensuing economic crisis. You know, nearly 3,900 social protection measures in almost every country of the world, representing 3% of global GDP in 2021. Now, of course, it was highly unequal between countries, right? So in high-income countries, they spent 90 times per capita more than in low-income countries, which just didn't have the resources necessarily to give the response. But I think really the valuable lesson from an HDP perspective from COVID-19 is that those countries with an existing social protection system were able to respond more quickly and more efficiently through horizontal expansion, expanded eligibility, or vertical expansion through top-ups, et cetera, and the modification of existing procedures. Whereas those who had to start from scratch or from weak systems experienced much longer delays and a much less efficient response. Thank you.
Okay, Ben, thank you so much for that. Let's now move on to our next panelist. This is Dr. Maria Nairo. Now look, thank you so much for joining us. What I want to get from you is a 7-minute response to what you've heard so far from your fellow panelists, but within the context of your areas of expertise, which is climate change and health. 7 minutes.
Thank you. Good afternoon, everyone. Let me be the one putting the big H here, H for health. I think this is what will be agglutinating all the interventions from the participants. Health will be a central point on a humanitarian response. One of the first things we need to organize when we have a crisis is exactly that, providing protection, providing water, providing food, and immediately then the health response. And I'm afraid from now on, the humanitarian and disasters and climate change will be all together. I'm afraid from now on, it will be very difficult to confront a humanitarian disaster which is not related directly or indirectly to climate change. So we all need to be prepared, aligned. This coordination among the different actors is fundamental. What's happened to health and climate change and humanitarian disasters? Climate change is affecting our health. And it's affecting our health because it's creating the perfect conditions for more diseases transmitted by vectors like malaria or dengue, and of course by water, lack of water and sanitation. Cholera was mentioned before, but all of the infectious diseases will be very, very sensible to the warming temperatures and the conditions that climate change is creating. Obviously, climate change is affecting our health as well because we'll be accelerating the intensity and the frequency of all of those natural disasters. And the first to suffer when there is a natural disaster will be humans and humans' health. So we have plenty of reasons why health has to be a very strong part of climate change. But at the same time, as the health system, we need to be better prepared for that. One of the things is that in a humanitarian emergency, you will need to provide health. And to provide health, look at these slides. I mean, imagine a healthcare facility or a little, even a mobile hospital without light. That's something that is almost impossible to provide health assistance because you need to keep a refrigerator for a vaccine, or you need to perform a minimum of a surgical intervention, you need to disinfect, you need to keep a communication, and therefore we need to make sure that our healthcare facilities are better prepared, are more adapted to what climate change will bring for all of us, and being climate resilient, better prepared to provide this humanitarian and health assistance that we need to provide. On the other hand, we need to make sure that we reduce our carbon footprint. WHO is working with other partners now to make sure that those healthcare facilities will now have access to sustainable sources of energy. We want to put solar panels, for instance, in our healthcare facilities to make sure that there will be more resilient, they will be less dependent of, for instance, diesel engines that we need to many times with other organizations to send to the field to respond to this humanitarian request. If our healthcare facilities, if our health system is more resilient to climate change, is better prepared, more adapted, if the sources of energy that we need are coming from sustainable sources like solar, I think those are innovations that can be very much replicated all around the world to make sure that when this health assistance is needed, we will be there. In that sense, we want to thank Saudi Arabia and King Salman for the support on this type of innovation, making sure that we will make our healthcare facilities around the world better prepared. The other thing is that we have an opportunity now to join forces and making sure that we are strategically aligned at the COP28. COP28 will be a moment where we need to tackle the causes of climate change. And if we all together claim and accelerate the ambition and the speed for more action on climate change, one of the most immediate benefits will be for the health sector. There will be plenty of benefits for the health community if we tackle the causes of climate change. We will reduce this exposure to the conditions that are creating this vulnerability for our population, and we need to make sure as well that access to renewable, clean sources of energy, access to safe water and sanitation, which are the basic public health needs, are provided to our health system and our health providers in case of a disaster. I think we need to align as well around some action-oriented right orientation and a strategic response, and of course, by default, collaboration among ourselves. Thank you.
Okay, fantastic response. Thank you so much for that, Maria. Let me move on to the panelist next to you, and that's Elke Meyerhofer. Thank you so much for being here. Now, I'm going to give you 4 minutes to answer the first of the 2 questions. There has been a lot of discussion whenever you talk about this, about building resilient communities, but you could argue that the goal is undermined by an insufficient knowledge of gender analysis. So how does that impact the ability of humanitarians to respond to the needs of other vulnerable people? And I'd like you to answer that within the context of your remit, please. Thank you.
Thank you very much, Juliet. Allow me to share 2 very specific examples, and one is actually related most recently to the earthquake in Turkey and Syria. So within a few days, the earthquake struck on the 6th of February, and on the 11th of February, the NGO Forum in Northwest Syria came up with the Rapid Needs Assessment called REACH. And the idea of the Rapid Needs Assessment was to analyze the needs among IDPs, those that had been newly displaced as a consequence of the earthquake, and also those that had already been displaced before in the host community. And so what they did is they looked at, they looked at 15,000 IDP households, and they looked at around 604 communities in the affected areas in northwest Syria. Now, for each one of the 604 communities, they took one key informant and asked a specific set of questions. All right. They came up with a 17-page report, and the 17-page report indicated what were the priority needs, how were people affected. Not surprisingly, it was really cold early February. Winterization was a key priority for both IDPs, but also the host communities. And then there was a bit of a difference between the newly displaced IDPs who were also in search or who were in need of shelter, while the host communities were more interested in multi-purpose cash assistance. And I think we had heard before, the people, affected communities really appreciate cash. Now, I mentioned 17 pages, not one mention of men, not one mention of women, not one mention of persons with disabilities. And so health came up as a need, but not very specific. It just said, well, people are displaced. There's currently a cholera outbreak in Syria, as we know, so there might be an issue. Now, let me put that in context. Among the 8.8 million people affected in Syria by the earthquake, there are currently more than 130,000 women who are pregnant. And of these 130,000 pregnant women who have been directly affected, around 15,000 are going to give birth within the next month. And yet we have an assessment that did not look specifically at the needs of women. I dare say, if I'm a woman and I'm displaced, yes, of course, shelter is important, but hygiene is important. If I'm a woman who is menstruating and I do not have access to hygiene items, I will not be able to access services. If I'm a pregnant woman and I do not know where to access reproductive health services, it is an issue. And so I'm just highlighting that because with all the good intentions, and the report obviously gives us a good idea about the needs, it really portrays a very male perspective and leaves out the very specific needs of women. Let me move on to Sudan. Quite a different example. So UNFPA, within the global coordination structure, hosts the gender-based violence area of responsibility. So we're coordinating GBV partners to prevent GBV and to respond to gender-based violence. And so we have a publication called Voices, and it is a certain methodology where every year we ask a certain number of key informants, we have focus group discussions, and we ask about gender-based violence. And the idea is really to establish trends. We're not looking at, incident data, prevalence data, but really what are some of the GBV trends to help us understand what the needs are. And so last year, we did this for the first time in Sudan. And we looked at where would a woman go to if she were a survivor of gender-based violence. And so in this Voices of Sudan's publication, what came out was women would first and foremost look for help within the family. They would look within the community. And if anything, they would look at traditional justice mechanism. Now, also in Sudan, there was a multi-sector needs assessment. And the multi-sector needs assessment was more quantitative. The voices was qualitative, so this was more quantitative. And more of the respondents were men. And it came to an entirely different result. So that multi-sector needs assessment, 80% said, if a woman is a survivor of gender-based violence, she will go to the police. Now, that is an important difference, because who of the two do you believe? And I think that the message really is, whenever we come up with a report and an assessment, we need to be very clear, what's the methodology?
Can I interrupt for a moment, please, because I'm very conscious of the fact
Yes.
that we need to stick to our time schedules as we
Perfect.
have to set aside time
I'll just
for the general
summarize it with
Q&A.
one
If you could be
sentence.
very, very brief, because there's one other question that I wish to put to you.
Excuse me, sorry?
If you could be brief in your summary, because I have
Yes,
another question
so
for you.
I'll just summarize in one. Different results depending on whether you talk to men or women. You always want to be clear, because your response is going to inform how are you going to respond to gender-based violence needs, and therefore gender analysis is important.
Right,
Thank
and
you.
it's a very good summary, and I hope that we'll have the time to actually look at that,
Absolutely.
the use of words. But my
Yes.
final question to you within this segment is whether you can give me a personal example, one personal example, please, of where a gendered perspective made a difference. 3 minutes, if you could stick to your time there, please.
All right. I'll try to be short. I had 3 examples. I will not have time. Let me look at the Horn of Africa. So yesterday we heard about the IPC. It was the FAO colleague who talked about the integrated phase classification that looks at different levels of food security. They just did a revision of the manual in 2021. And the manual does look at gender. It looks, for instance, at women and their dietary needs. If you're pregnant, if you're breastfeeding, you have specific dietary needs. What the manual does not look at is gender dynamics, right? So for instance, we know there are household dynamics that predispose women to certain gender-based violence. We know, for instance, when it comes to assets, women own less assets, women have less say, where do resources go? And the very same factors that expose women to food insecurity also expose them to gender-based violence. So now, what's the lesson learned? The gender-based violence at a global level area of responsibility came up with a manual where they said, we need to be better. We really need to look at the dynamics and say, if there are certain dynamics at household level that will result in gender-based violence, we need to better understand why. And so it gives guidance to the people who are conducting the integrated phase classification assessments. It also looks at the gender-based violence practitioners, and it also looks at the food security people so that we can improve and better look at gender-based violence.
Elke, well done, and thank you so much for that. Let me move on now to your fellow panelist, Kit Dyer. Good to see you. My question, is there an absence of long-term thinking among humanitarians, given that what works today might be irrelevant in 5 years' time? You have 4 minutes.
Thanks, Juliet, and thanks, KS Relief, for giving me the opportunity to listen to some of the panelists and participate. The question's really quite simply phrased, but I think it's a bit more complex. It's a bit of a yes and no kind of context, I guess. Most of our humanitarian action is driven by funding, is driven by the principles and standards that we hold ourselves accountable to, and it's driven a little bit by organisational mandate. And by necessity, quite a lot of that is short-term and humanitarian. We have a life-saving focus. So on the one hand, a little bit yes, but we also then recognise that those life-saving activities don't happen in a vacuum. They happen to communities, to people who have had an experience before and who will have an experience afterwards. So yes, it might appear that often our lens is quite short-term, is we're only thinking to the next 3 months, 6 months. But in reality, we're trying to find these mechanisms to lengthen that lens. We talked a bit before, some of my colleagues here talked about the nexus programming between peace and development. That's something that's quite critical, and there's a lot of movement at the moment trying to figure out how we can do that practically and in reality. I think there was a good description a bit earlier about some of those really practical pieces around Nexus programming, and more of those kind of opportunities will be coming up. I think there's also an opportunity for us to lift our heads a little bit from this short-term life-saving goal when we look at some of the humanitarian architecture, and particularly around coordination. My colleague from OCHA talked a little bit about that. I think the coordination platforms do give us the opportunity to have a bit of a longer think about what we're doing now and the impact of it into the future. And the final piece where I think there's a little bit of an opportunity for us to perhaps do better is to really grab hold of some of the innovation that is going on in our sector. And I'm not talking mostly about technology, but about systems and processes. And I think some of the innovation that's going on around forecasting and insurance gives us, in the technical sectors like my own, a real opportunity to look into the future, to try and come up with these life-saving solutions for right now that do have an engagement with the future.
Okay, thank you very much. My second question to you, and you have 3 minutes. Is there any value in setting strategy timelines when you have no idea what's coming around the corner?
Yeah, thanks, Juliet. That was an interesting question. I thought a lot of the organisations now have resilience strategies. A lot of governments have resilience strategies for communities. And when I think about the timelines that we put inside them, there is a value to putting a timeline into any strategy. It means that we have something to be held accountable to. There is an action that we must take by a certain time. However, then recognising that the future is quite uncertain. We talked about this context that's terribly changeable. If we look at climate change, we've got some ideas of forecasting, but we really don't know what's going to happen a lot of the time. So the strategies we have, when we think about the outputs, perhaps, the outputs are a little bit set in concrete, but our outcomes are very much at a resilience kind of level. Then I think the timeframes we're talking for and the timelines we're looking for perhaps need to be flexible. And it's those actions that we also then need a bit of flexibility. There's a couple of really nice examples of this where we try and bring in the analysis that allows us to have the flexibility in our resilience strategies. I work for UNICEF, and we're looking at I think the short term is a CLAC, and I've completely forgotten what it stands for now. I think it's a climate landscape analysis for children. Sorry about that. That gives us the information that allows us to look at all of the sorts of things about programming for children, both in humanitarian action and development action, through a changing landscape. And it gives us that flexibility in the programming that if we need to change something, we can change something. If we need to steer in a different direction, we can. And then two other things I think offer us opportunity as well. One is the localization agenda. It's very easy to say that, but I think it's it needs to be really grounded with funding and with programming, because that's where resilience really happens. It's not at my level. It's when we're working with people on the ground. And the third area that I think is an opportunity is the changing support provided through humanitarian action, the changing modalities. We've talked about social programming and cash and voucher assistance. I think that is a real opportunity for resilience because it offers choice.
Okay, Kit, thank you so much for that. Manuel Pereira, don't hide. I can see around corners. Look, thank you so much for being here. My question to you, and I'm giving you 4 minutes, is I want to get your perspective on these enormous challenges that humanitarian work is going to face in the coming decades, vis-à-vis climate change that we've referenced here, and also how innovation can contribute towards addressing them. 4 minutes, please.
Thank you. Can you hear me?
Nope.
No sound?
Can we have some sound on his microphone, please?
Hello?
Thank you, that's great.
Thank you, Juliet, and to KS Relief for being here. I think that there's a question of perspective first on my presentation. I invite everyone, maybe not now, to go to the internet and look at a model that exemplifies how our solar system moves through space. And that is completely different from the way that the majority of us sees where we fit. And it's exactly the same approach that we need to take vis-à-vis climate change. The interconnectedness between the physical processes and the interaction with humans and societies is different from anything that we have done. It's much more complex. And societies and communities are not prepared to address these issues. Innovation is very important, but in humanitarian assistance, there are things we cannot innovate anymore. It's very difficult to link access to technology, time availability, and scale, and still deliver a response that would be the optimal solution. We cut corners at all time. So innovation is always pushed to be fit for purpose or to be one step ahead of the basics. We are still discussing in 2023 plastic sheeting. That's one of the best things that can be done in an emergency, because you fold it, you put it in pallets, you ship it fastly, and it's how you use it, not the material. And so technology can have a role on that, on making people more aware of what's to come. And today was already referred the initiative of the Secretary General on early warning systems for all, but it needs more. We need to bring the changes on livelihoods. We need to bring disaster preparedness. No disaster is natural. A disaster can be a man-made technological incident or a natural hazard. It's how people in societies are organized and how they interact with this hazard that happens. People in floodplains get flooded. People in earthquake-prone areas that do not have building codes up to standard get damaged. Drought areas that do not have adequate management of water systems fail. When we don't take care of the ecosystems impact on water availability, on the rest of the biodiversity. So I think that the big challenge we have is to comprehend where we fit, how climate will impact these processes, and help communities and governments, above all, to tackle that in a structured way.
Okay, passionately explained. Thank you so much for that. My final question to you in this segment: how can humanitarian work contribute to better resilience, mobility, and capacity to address the impact of climate change, environmental degradation, and disasters? You have 3 minutes.
Thank you. I think that humanitarian work is at large a political act, because it's always derived on a system not having coping capacity and asking assistance. There's many countries in the world where crises do not need this extra effort. So it's also important to do the groundwork before. We talk a lot about localization, but there cannot be localization just by getting people and hiring them after a crisis. It's building their capacity before, asking them what resources and what capacities they need if they face a disaster. This forward-looking planning is what builds resilience, because when you are discussing solutions, you are also discussing the root of the problems. And when you discuss the root of the problems, you have the door to change things. Humanitarian work many times contributes to that, but the notion of the need of humanitarian work can also build resilience. We should think that the presence of systems to address crises, led by governments, empowering communities, and putting people at the center of what one day may be that response will be much more transformative than any practice we write to arrive to a place and try to implement it. And this balance is where I think we need to keep investing on countries, on their capacities, on changing the systems, and progressively we will have less need of humanitarian assistance. We'll always need it, it's the world, but at least we can try to mitigate it.
Okay, thank you so much for that, Manuel. I can see a lot of people nodding in agreement with that, so thank you. I'd now like to leave the final comment to Sheikh Hissa Al-Thani, because she's going to give me a 7-minute response within the remit of what she does. 7 minutes, and just to the audience and the panel, of course, she will be speaking in Arabic. So to non-Arabic speakers, there should be headsets with translation. I believe that if you want to hear the English, it is channel number 5. So Sheikh Hissa Al-Thani, the floor is now yours. You have 7 minutes. Thank you. Sheikha, can you hear me?
Yes.
Yes, lovely. So you have 7 minutes. 7 minutes, the floor is yours, and I believe you will be speaking in Arabic. So 7 minutes, responding to what you've heard so far.
Yes.
The floor is yours.
Okay. I thought you will ask me. Okay, thank you. السلام عليكم ورحمة الله وبركاته. شكرا لمركز الملك سلمان والقائمين عليه لإتاحة هذه الفرصة لي للمشاركة. سأحاول أن أركز بشكل أكثر خصوصية على التحديات التي تواجه العمل الإنساني في العالم العربي. وسأبدأ ب4 حالات تتطلب مساعدة إنسانية عاجلة، ونحن نعيش إحداها هذه الأيام. هناك 4 حالات تتطلب تلك المساعدة: حالات الحروب والصراعات المسلحة بما تشمله من خسارة الأرواح والممتلكات والإصابات والتهجير والحاجة للملاجئ والرعاية. الكوارث الطبيعية مثل السيول والفيضانات والجفاف التي تؤدي إلى خسائر هائلة وتتسبب بالمجاعات، والصومال أكبر دليل على ذلك. أما الزلازل والبراكين التي لها نتائج أكبر وأكثر، فإننا لهذه اللحظة ما رد الفعل بأننا لا يمكن التنبؤ بها أو إيقافها. الكوارث الاقتصادية الناجمة عن سوء الإدارة أو الفساد، والتي ينتج عنها حرمان أعداد هائلة من السكان من الموارد والقدرات الاقتصادية، ذلك يؤثر على التغذية، السكن، التعليم، ممارسة مهنة الطب. أزمة الغذاء العالمية، وتلك تصبح أكثر صعوبة في الدول التي تفتقر للخدمات الاجتماعية والضمانات إلى الموارد الضرورية لحماية السكان من تبعات الركود الاقتصادي. إذا تحدثنا عن التحديات التي تواجه العمل الإنساني أو ممارسة الفاعلين للعمل الإنساني، نجد أن المساعدات الإنسانية التي يتم إضفاء الطابع المؤسسي عليها وتتجاوز بحكم التعريف الإغاثة الفورية، ويتم تقديمها يعني في الأغلب من قبل وكالات ومنظمات الأمم المتحدة، وعادة ما يكون المقر خارج العالم العربي وتصل للمستفيدين من الدول النامية. تلك الدول تكون أيضا خارج العالم العربي، فهنا تصبح بعض عدم الوضوح لتلك الإغاثة. في أغلب الأحيان تغفل تلك المنظمات الأممية والدولية عن الاستخدام المرشد للطاقات والموارد البشرية، في بعض الأحيان إن صح التعبير، البشرية الموجودة في البلدان التي تستهدفها. لذلك غالبا ما تكون الشراكات مع الحكومات والمؤسسات الحكومية التي غالبا ما تكون غير معنية بمساعدة المواطنين أو عاجزة عن تقديم الخدمات. فالشراكات تصبح أكثر فعالية مع الجمعيات المحلية والمنظمات غير الحكومية التي لها صلة مباشرة بالناس واحتياجاتهم. غالباً رقم 3 تبدأ الإغاثة الإنسانية المحلية في الدول الفقيرة بعد الكوارث من متطوعين محليين لا ينتسبون لجمعيات، ولكن أشخاص يجمعون بعضهم البعض للمحاولة في المساعدة، ولكن ذلك يكون دون تخطيط أو تنسيق، معتمدين على النية الحسنة وإنسانيتهم، مما قد يؤدي إلى ازدواجية في تقديم المساعدة، وقد تفتقر إلى الفعالية على المدى الطويل. وعند ضعف الاستثمار والتنسيق وتوجيه الطاقات الموجودة في المجتمعات المحلية، للأسف تذهب تلك المساعدات سدى، وتؤدي إلى إحباط المعنويات لدى المتطوعين الذين يقل الحماس لديهم للعمل الإنساني. هذه أما في حالات أخرى توجد للأسف معوقات سياسية تؤثر حتى على وصول المساعدات الإنسانية. صعوبة الوصول تتمثل في جغرافياً، وذلك يحدث في اليمن وفي دول عربية أخرى. صعوبة الوصول فيما يتعلق بوصولنا نحن أو وصول من يريد المعلومة، فقد لا يصل إليها أو يصل إلى معلومات غير صحيحة أو مضللة. إذا تكلمنا عن صعوبة الوصول فيما يخص الأشخاص ذوي الإعاقة، فإنها تنطبق عليهم بشكل كبير، فأحياناً حتى لا نصل للمتضررين منهم. تنظيم الإغاثة الإنسانية يشمل في حالات الكوارث الطبيعية شراكات كبيرة مع المؤسسات الحكومية وغير الحكومية والمتطوعين والقطاع الخاص والمجتمع الدولي، ويشمل تنظيم كم هائل من المساعدات العينية والمالية والخبرات والمعرفة. كل ذلك يتطلب قيادة وتنسيق وتوجيه وتوزيع مناسب، وإلا تصبح تلك المساعدات الإنسانية في حد ذاتها عائقاً في وجه الإغاثة الإنسانية. وفي العديد من الحالات فإن الأعداد الهائلة من المساعدات والمتطوعين الذين يتدفقون على المناطق المتضررة دون أي تنسيق أو توجيه مناسب، ذلك يتسبب بمعوقات لوجستية وازدحام، ويشكل خطورة على كل من ليس لديه خبرة في كيفية التصرف في الأماكن الخطرة، ويضيف أعباء على المسعفين وخبراء الإنقاذ والإغاثة. معظم أو بعض الدول العربية لا تمتلك معدات الإنقاذ والحماية الضرورية لعمال الإنقاذ، وليس لديها التدريب والتأهيل الكافي للمتطوعين. وقد رأينا وللأسف في الكارثة الأخيرة في سوريا حيث اضطر عمال الإنقاذ إلى رفع الأنقاض بسواعدهم لعدم توفر الآليات اللازمة. الأخبار والمعلومات والشائعات المتداولة عائقاً جديداً على عمليات الإنقاذ. في بعض الأحيان لا تكون الأخبار ومصادرها محل ثقة، أو يتم التخفيف أو التهويل في الوضع بناء على اعتبارات سياسية أو استخدام مواقع التواصل الاجتماعي لنشر الشائعات وتداول الخرافات، وذلك ينشر الذعر والفوضى في المجتمعات، وذلك يؤدي إلى إرباك المساعدات ووصولها إلى الجهة التي يفترض أن تصل إليها. المؤثرين أو الانفلونسرز والسليبرتيز وطالب الشهرة أحياناً ظهورهم على وسائل التواصل الاجتماعي أيضاً وتقديم معلومات قد لا تكون حقيقية تؤثر على الوصول للمساعدات. في العالم المعلومات بالنسبة للأشخاص ذوي الإعاقة كما قلت أضيف عليها أيضاً ضعف المعلومات فيما يتعلق بالمسنين. التمويل، قلة المساعدات الإنسانية والدعم المالي واللوجستي والفجوة بين الموارد والاحتياجات الإنسانية آخذ في الاتساع، والمرجح أن تتسع هذه الفجوة العالمية في التمويل الإنساني في ظل هذه الأزمات العالمية المتسارعة. عربياً نعاني من قلة المساعدات الإنسانية أو تقديم المساعدات في الشكل المتعدد الأطراف، وخاصة فيما يتعلق بجامعة الدول العربية، وإنما يقتصر على ثنائي الأطراف، بينما تفضل الدول العربية تقديم المتعدد الأطراف مع المنظمات الدولية والمنظمات الأممية. نواجه مشكلة كما ذكر الجميع بخصوص توطين الاستجابة، وفي كثير من الحالات كان عدم التكيف الثقافي عائقاً في وجه تقديم الخدمة والمساعدات للأشخاص الذين يستحقونها. سأتوقف.
Sheikha, thank you so much for that, a very comprehensive response to my question. Can you also please show your appreciation to the panel, because I have put them under terrible pressure and they have survived the ordeal and it's not even over yet. Thank you.
Oh, no,
because we have roughly 19 minutes, a lot of ground to cover. Are you ready? Tough if you're not, because my question to all of you, the opener, I don't care who answers it, but if you hesitate, I'm going to choose somebody. I'm looking at this from an outsider's perspective, but I get the impression that it's more difficult being a humanitarian now than at any other time. And given the multiple crises that you guys are facing, is it time to rethink perhaps how you do your job? Is it time for perhaps to get some new skill sets? And if so, what are they? Who'd like to tackle that one? It's a biggie. Maria, you look very enthusiastic.
Yeah, thank you very much. I will bring a word that is probably critical in this debate, is going back again to prevention. I think we need a massive strategic strategy of prevention all aligned, because we will be seeing more and more humanitarian disasters, particularly related to climate change. So I think we need to reduce emissions, go to the mitigation of the climate change, the causes of climate change, and that can already be a kind of barrier and obstacles to prevent at least some of the most critical humanitarian crises we are facing, and that are affecting so much the health of the people. So a call for being a medical doctor, a call for prevention, prevention, and prevention.
Okay, would anyone else like to respond to this? The overall question itself, it's a more difficult job, but also, do you need a new set of tools to approach your job in a different way, an innovative way perhaps? Jesse?
Sure, yeah.
Can we have his microphone, please?
I think we're here. I think we arrived, you know, and I think part of the issue when we first started looking at these new tools was we always looked for the weakest link. And so oftentimes we would say, we need these new innovative tools and new innovative ideas, and people would say, but where's the financing? And so then this was where we started having these wonderful talks with OCHA around how can we start to bring that type of resources to our country teams. And then the idea was, well, we don't have enough capacity in our own tools and our own selves. And we started to hear from Germany and the UK and Norway and Denmark and saying, we're here to support this change. We're here to support you with these ideas. We're here to start to bring these types of capacities to your country teams and to your HQ offices. And then we started to hear from today on our panel and from others that we need to do this together. We need to bring our collective resources together and start to be able to not just, as I said at the beginning, hope that the sum of our individual agencies will somehow magically arrive at this amazing collective approach, but actually sit down and have these conversations long before that these hazards had turned into humanitarian disasters.
Effectively.
Exactly.
Yeah. Would anyone else like to add to that? Oh, sorry, Lisa. And then, Kit, do you want to talk after Lisa? Okay, Lisa.
Yes, yes, I'll just say one thing. It's really a softer skill. I mean, there's technology we talked about, which I think we can integrate much better into humanitarian assistance, but as a softer skill, I would say listening. And that's something that I alluded to when we had a listening project recently to really see what is it that people, what do they need, how do we address those needs in a very different way so that it really addresses what they themselves say they need.
Okay, thank you. Kit. Microphone, please.
To add to what Lisa said, as well as the listening, it's the voice at the table. So it's expanding the skill set, but also the voices who are part of that conversation. And that's something I've seen change quite dramatically since I started 20-something years ago. That there's more youth at the table now talking. There's more people with disabilities actually have more of a voice. There's different languages at the table. And that's a big step forward, and I'd like to see more of it.
Okay. Sheikh Al-Thani, I saw you nodding in agreement. Is there anything you would wish to add in response to that question before I try to get to some other points as well in the time available?
نعم، أريد التوقف عن مسألة التشجيع والحث، ولكن أن يكون فعلا هناك أبحاث تعمل بشكل جاد وتكشف عن مصادر الخطأ أو السلبيات التي نقع فيها في العمل الإنساني، وتضع خطط واضحة واستراتيجيات أو سياسات للعمل بها. كذلك لا بد من التأكد من دمج المقاربة الإنمائية ضمن الاستجابات الإنسانية، لأن ما يحدث مؤخرا جعلنا نبتعد عن الإطار العمل التنموي والتركيز على الإغاثي بالدرجة الأولى. ولا أرى أن حشد تشكيل قاعدة من الممولين هو أو قاعدة أوسع من الممولين هي الحل، ولكن أرى تغيير سيناريو المؤتمرات والاجتماعات التي تعقد من أجل التمويل وتشجيع المانحين هي التي لا بد أن تتغير. المانحين يحتاجون لصور عملية واضحة توضح الخط الذي نقدم به المساعدات، من أخذ ماذا وكيف نكمل الفجوة في تقديم هذا التمويل لتقليص الفجوة بين الموارد والاحتياجات الإنسانية. شكرا.
Thank you very much for that, Sheikha. And also, Manuel, would you like to respond before I move on to the next question? Because I saw your head lowered and your hand moving, so I guess you were taking notes, or not?
Me?
Manuel, can you hear me?
Yes. No, I think that is the fundamental. The skill set is an analysis skill set, right? We need all kinds of skills to make this work. The day that humanitarians are one profile of one type, we are in trouble, because that doesn't represent the diversity of finding the right solutions for the diversity of people we interact and problems we interact. But I also think that what our colleague here said, changing how we interact, especially with governments, changing how we practice. We need flexible funding, because if we have a prescribed medicine of how to solve a problem, we can never think on how to find it another way. Edison said, it took me 100 times to find the lamp. I know 1,000 ways not to do it. And that's where we need to focus.
Okay, let me move on to another question. Ben, I'd like you to take it. And again, I would like the panel to give me your response to what he says. Because look, outsiders looking in, we feel that humanitarianism has a very strict sense of principle. But given the difficulties in which you're working, is there a risk that perhaps principled humanitarianism could be marginalized because there are so many complexities that you're having to deal with? You cannot approach situations in the same way. Ben?
Are you looking at me? Okay.
You are the only person on the panel called Ben, I believe.
I didn't hear your name, I'm sorry. No, I think what I think is, I'm not sure how to respond to that, in the sense that, I think by definition, the humanitarian response is principled, right? What I think really there needs to be, in a sense, is a new attitude. Because I feel as though, we talked again about kind of new skills, new people coming together, but I feel as though there's still too much competition and not enough collaboration among us actors, right? We compete for money, we compete for space, and we don't complement each other and collaborate when we all bring a diverse set of skills, right? And I think part of that is because, many of the actors were dependent on soft money, right? And so we fight for that soft money. I think that, so I think that's one issue, and I think that's an issue that, we honestly need to face and address, again, in an honest way. Secondly, I think, again, this issue of prevention is extremely important. Many people have talked about it. Again, I think there's a problem with incentives, because donors like the humanitarian response because they like to spend the money and see the impact. It's immediate, right? If you focus on the root causes, it takes a long time to see the impacts. The efforts aren't immediate. You have to believe in what you're doing, and the incentives don't always line up, right? And so I think there needs to be really a reevaluation of some of our attitudes in terms of how we face the humanitarian issue, the kind of things we want to focus on, let's say, that we need to invest in things that are going to have a long payoff. They're not going to be immediate and visual, but in the end are going to end up costing us a lot less money and having a much more sustainable impact.
Okay then, and Elke, what's your response to that, please? Oh, Elke. And also, Maria, if you'd like to follow up on Elke's remarks to what Ben has just said in response to my question about principled humanitarian perhaps being at risk of being marginalized because the situations you're dealing with on the ground are so complex, you cannot approach situations in the same way.
It's a very difficult question, particularly when it comes to principled humanitarian response. But you also mentioned context, and it really takes me back to accountability and accountability for affected populations. And it is true that sometimes we think we have the solutions and we have the tools, and sometimes the solutions are really there on the ground, and what's needed is for us to empower people and to really listen to them. And I know, for instance, when we look at there's a global youth compact that, for instance, says very clearly, nothing for us without us. And I think that's really the principle for me. If I go anywhere in Sudan or here in Saudi Arabia, what do I really know? I have my skills, but I don't know the local context. And I need to listen to that older person. I need to listen to that woman, to that boy, to that girl, and really say, what is it that you need and what's not working right now? And I think that's ultimately, sometimes our processes are very cumbersome and very long in the planning. And then we tend to talk to each other and sometimes miss out on actually listening to the affected populations.
Okay, thank you. And Maria?
Well, I think in the last years we have advanced a lot in terms of coordination on a more strategic planning and preparedness and response, particularly on the health aspects of the humanitarian response. But still, when you see in certain communities that the donors will be maybe ready to give you financial support to buy ringgit lactate, for instance, which is you need to put it on a plane, you need to translate it to the place, and that's very costly. And maybe you don't have the resources to spend and invest on water and sanitation, which is the one that will be prevented at front the occurrence of a cholera outbreak. We have cholera-prone places around the world where we know that certain investments in terms of, again, prevention, preparedness, and readiness to respond will be extremely effective. So that's maybe one of the aspects where we need to balance and see where do we invest on preparedness, readiness, response, with a little component of the prevention part as well that we need to prepare for it.
Okay, thank you very much for that. The window on our timesheet is closing, unfortunately, but I want to put this question out to all of you. If I can start with you, Lisa, and then move it along to the panel before we go to the recommendations. Because look, again, the outsider's view that the humanitarian architecture has been blindsided by events that are not necessarily recent. So very briefly, how much of this current crisis was predictable? Lisa.
Well, I think what we've seen is evidence that 30%, not necessarily of this current, but 30% of overall needs can be predicted. We can look at climate. We see less so anticipatory approach being able to be applied to conflict specific. It can be applied to climate-related disasters in conflict areas or in fragile spaces. So I think that we can predict some, we can act earlier, and I think that's something that we need to do, and we've spoken about quite a lot during this forum.
Okay, thank you. Jesse.
Look, I mean, I think we've heard over the last 2 days a lot of the answers around what we need to do to deal with the current situation. And I think we all know in our own lives that working together is imperative for us to arrive at solutions. I don't think where we've arrived was a surprise. I think this is why we're here today. I think we knew that this was coming, and that oftentimes we really need to be able to be pushed against the wall in order to start making these big changes within ourselves, within our organizations, and with our partners. And I think now we have the tools in order to start to address this new future that we've arrived at.
Okay, so some optimism there. Ben?
No, I think some is predictable. I mean, a lot of around climate change is predictable. It's clear. Many conflicts are predictable. Some are totally unpredictable. COVID-19 was pretty unpredictable. Yet it's clear that many of the systems that were in place helped respond. And we can see how even if we have totally unpredictable crises, if you have certain systems in place, it can help respond. And so I think the response to COVID-19 for me, on the one hand, gave me a lot of hope because countries responded, and you could see how they responded, and it was in a very powerful way. On the other hand, a crisis like COVID-19 just really heightened and underlined the extreme inequalities, let's say, and the incredible effect it has in terms of setting us back in time in terms of on many aspects. Because of the unequal impact, right? So particularly women's rights, women's participation in the economy, it was set back decades, let's say, and in a number of dimensions. And so, there's both optimism as well as...
Yeah. Okay, but look, thank you so much for that, Ben. And Maria, can I get your take on that question, please? My final question, in fact, that the humanitarian architecture blindsided by events that are not necessarily recent, so how much of this current crisis was predictable? If you could be brief, please, so that I can move it along to the rest of the panel.
To me?
Yes, thank you.
If you look at, from a health point of view, a humanitarian crisis related with a strong health component, I think we can predict many of the outbreaks related to the weather conditions. The collaboration with the World Meteorological Organization is telling us where the conditions are preparing for a cholera outbreak. When you have a lack of access to safe water and sanitation, it's not difficult to predict. When you have a problem of malnutrition, it's not difficult to predict that you will have a humanitarian crisis. So that's why I think, again, we need to invest on the basic of using as much as possible all of those predictive mechanisms that we have for health, having a system for preparedness, readiness, but as well investing on what will be prevented at the source. And it's the causes of climate change. We need to reduce emissions, we need to invest on sewage systems, we need to invest on water and sanitation, and we need to invest on renewable, clean sources of energy that will reduce that dependence and will ensure us that in case of an emergency, we will have our health sector functioning more resilient to climate change, because no matter what now, climate change will be affecting all the humanitarian preparedness, response, and predictability as well.
Okay, thank you very much for that, Maria. Elke.
So let me be a little bit provocative. I've been a humanitarian practitioner for a very long time, and I would think that the humanitarian architecture is ever evolving. Where we are now is not where we were 10 years ago, and I think it's doing a fairly good job overall, but also keeps learning. The scope of the challenges is such that it's really difficult for the humanitarian system alone to be able to respond to it. And where I want to be provocative is, I think what we see is also a bit of a failure of the development system in many ways. And often when we hear preparedness, we think automatically humanitarians. Preparedness does not happen at humanitarian level. Yes, we can preposition and all of that, but it's really the push it back to governments, how are governments prepared when it comes to disaster risk reduction plans? How do they integrate the response? How do you build a system? If you have a supply chain system that even at the best of times is not working, it will not work during a crisis. And it takes us back to the nexus. I think humanitarian response works better if there's a strong level of preparedness from the development side, and if we can also phase out and hand over.
Okay, thank you so much for that, Elke. Kit.
I don't think there's much I can really add. The comments have been, every time I come up with something, somebody else has just said it.
It's called telepathy.
I really pity the people down the track. Anyway, I absolutely agree with everything everybody said, and I think I'll come back to the comment I heard on the first day, which honestly I should have known from ECHO, that 80% of people affected by crisis are affected by a crisis of conflict, not another kind of natural hazard. And that makes me think, wow. I think we are to a degree doing the job that we need to be doing as the humanitarian architecture, as the humanitarian sector. But there's a big elephant in the room, is the people who should be doing their job to stop the conflicts. I know it's not that simple, but there's a lot of work that can be done outside our sector to make our lives more effective and to do what we're supposed to be doing.
Okay, thank you very much for that. Manuel.
I don't think the problem is the architecture.
No.
The issue is that we are not listening to the architecture. A lot of the problems we face today are predictable and preventable if there is enough interest and political will and cooperation to make it happen, right? I'll give an example. In the International Panel of Climate Change on Annex 10, there's a map that says that between 2041 and 2061, a large center of the planet will be more than 100 days a year with temperatures above 35 centigrade. Large numbers, very large numbers of people in humanitarian settings live on these. We are being told that it's going to be impossible to live outside for 1/3 of the year. This is a graphic on an annex on the most important scientific report we have. What are we going to do about this? So it's not about the architecture. It's about the information we have and where to prioritize the most strategic interventions to save lives and prevent people to be in distress situations that stress the humanitarian environment and funding.
Okay, thank you very much for that, Manuel. And can I have the final word, please, from HISA? If you could be very brief, because we are about to close out.
Okay. Thank you. هناك كثير من المقترحات التي قيلت، أتمنى أن يكون هناك تشارك فيها. النقطة الأولى التي أود أن أؤكد عليها بخصوص العالم العربي هي موضوع الاستجابة الإنسانية التي تفضلت فيه الزميلة، لأن منذ بدأت الأزمة في العالم العربي كانت هناك استجابة إقليمية وضعت بواسطة الأمم المتحدة الأوتشا، بناء عليها كانت هناك استجابات محلية، ولكن بعد ذلك أين الاستجابات المحلية من قبل الدول العربية؟ وليس بالشرط أن تكون فقط الدول المستضيفة للاجئين. هناك الآن كوارث طبيعية، آثار متغيرات مناخ، وهذه الكارثة الأخيرة، فأين الاستجابات المحلية لتلك الدول التي لابد أن تتصل بالاستجابات التي على مستوى الدول وعلى مستوى الأمم المتحدة؟ النقطة الأخرى، أرى أنه عربيا لابد أن تكون هناك آلية عمل مشتركة ننادي بها منذ زمن طويل، ولكنه أعتقد وأتمنى من هذا المنتدى أن تخرج توصية قوية أن يكون هناك آلية عمل مشترك لعمل إنساني عربي. ولدينا من المنظمات الإقليمية أكثر من منظمة، أتمنى أن تكون تحت مظلتها أو ضمن أي إطار، ولكن أن يكون أساسها التنسيق والتعاون، ويكفينا هدر الوقت والجهد والمال. شكرا.
Okay, thank you very much.
Thank you.
I think it's fair to say that your remarks actually resonated with the audience. Can I just close this out now by looking at some of the takeaways which has come from this, from the individual answers to the questions which I posed to the panel at the beginning, and also the responses now. First up, we need to increase international efforts to ensure serious commitment against obstacles at the humanitarian level in order to reduce the growing risks in conflict zones, emphasizing the importance of solidarity and strengthening partnerships in humanitarian action to meet the challenges of humanitarian work, so that a strategy for humanitarian intervention is developed in this regard. And the final thought, strengthening partnerships and also developing innovative solutions in the field of humanitarian action to reduce the repercussions of natural disasters, conflict, food insecurity, displacement and refugees. All of this can be addressed by developing mechanisms to deal with this challenge. Panel, you have your work cut out for you, not just for today, but for the rest of the year, over the decades to come. I wish you the best of luck, and hopefully if we meet again in a decade's time, perhaps even less, we can actually do a check on your progress. And I'm sure that the audience may also be involved in discussing this to see how well or badly you are doing, but I have great faith in you. Thank you so much. Please show your appreciation to our panel for a brilliant contribution. I'm so sorry to have rushed you all in your answers, but you were magnificent. Thank you so much for covering so much ground. Please, if you could remain where you are, because there will be another panel in a few moments presented by my colleague Liz Munro. Thank you. Oh dear.